So hello and welcome to the Treating Trauma Without Drama Telesummit. I'm your host, Dr. Patricia Sherman, and I created this summit to address the needs of so many mental health practitioners I know who want to be able to treat clients who have experienced trauma, but are afraid to because they don't want to hurt anyone. My guests were especially selected to put you at ease about that. They will help you realize that you already have many of the qualities to do well and provide you with strategies that will help you feel more comfortable and skilled. I'm so glad you're here. I know you will love listening to my guest, Janeen Herskovitz. Janeen is a licensed mental health counselor in the state of Florida and owner of Puzzle Piece Counseling, LLC. She earned her bachelor's degree in special education from Rowan University in New Jersey in 1995 and her Master of Arts in mental health counseling from Webster University in 2010. She is trained as an EMDR trauma therapist and writes as a topic expert contributor on autism spectrum at goodtherapy.org. She's been married to her husband, Joe, since 1995, and together they have 2 teenage children. Janeen's weekly podcast, Autism Blueprint, designed for parents and professionals, and covers a variety of topics surrounding living with autism in the home. So welcome, Janeen, and thanks for being here today. Where are you calling in from?
I'm from St. Augustine, Florida.
Okay, cool.
Yeah.
So what led you to work in the field of autism?
Well, it mostly started because I have a child with autism. So back when I was a stay-at-home mom, my son was diagnosed with autism when he was about 3.5. And that took me into my own mental health journey as a patient. So as a result of going through my own therapy for basically the grief and loss that was associated with the diagnosis, that led me to become a therapist and working specifically with that population, the families that live with autism.
Okay. So when did you first start as a therapist, start treating trauma?
I started treating in 2010. Actually, if I go back to when I was in graduate school in 2008, I did a project on for group therapy, a group therapy class that I had, and I centered the project around autism moms. And at the time, I was working for a local foundation here in Jacksonville that focuses on autism, and they allowed me to do the support group that I had designed for the class.
Cool. Yeah.
And it's been running ever since.
Oh my gosh.
Yeah. Isn't that neat?
Yeah.
So I had the guidance of a
later,
professor. Yeah. So my professor helped me design it, and I did it as a class project. And now to this day, I mean, tomorrow night I'll be leading another mom's group, and we run it year round, several sessions a year. So I technically started working with those moms who I didn't realize were traumatized back in 2008, and started seeing the similarities between them looked a lot like PTSD. And it turns out it is PTSD.
So can you talk more about that? What symptoms were you seeing? How did you pick that up?
I was seeing a lot of just mental and physical exhaustion, a lot of them wanting to avoid certain situations, like social situations where if their child had a meltdown in the supermarket, they wouldn't want to go back to that supermarket, and just low-grade depressions. Some of them who had had trauma in the past already in their childhoods would be triggered by the current situation that they were in with their child. It's just so overwhelming and so much to deal with when you get that diagnosis that any issues that you've already had kind of come right to the surface.
Mm-hmm. And did you find that for yourself in your own journey?
I sure did.
Yeah. Can you talk a little bit more about that?
Absolutely. I'm an open book with stuff like that because I feel like a lot of the moms that come in to see me need to know, this process you're going through is typical for having a child with autism. I hit the ground running from the start. My son got diagnosed. I think I cried for a day, and I was like, okay, how are we going to fix this? What do we need to do? My poor husband was kind of waiting back. It was like the train was leaving and I was on it. I'm driving this train and he's back at the station going, wait, I don't even know what autism is, and you're going ahead. So a lot of times I have to help moms and dads kind of get on the same page because they do grieve at different rates. And so he was grieving in a pretty normal process of grieving. And I was just in denial that I was grieving, because I said, no, I'm going to focus on the positive. I'm going to focus on the gifts, which is great. But then about 2 years later, I fell flat on my face with extreme depression and panic attacks and anxiety. And it was a mess. I was just a mess. So I needed to go get help for myself. And through that process, I realized there's a lot of help out there for the kids, but there's not enough for the parents.
I think people don't necessarily realize that it's a traumatic experience to get a diagnosis that your child isn't the child that you thought you had.
Exactly. Yes. And in fact, there was research that came out right in about 2006, 2008 that said that the experience of having a child diagnosed with autism in particular for mothers was similar to that of combat soldiers.
Wow.
So, that's a big statement to make, that this study evaluated the two populations and found a lot of similarities.
Yeah. And I think it's not unusual for parents to grieve differently.
Mm-hmm.
And sometimes that leads to a disruption in the relationship and in the marriage. Yeah.
Yes. And that was our case as well. At one point, we had a marriage therapist, I had a therapist, and my husband had a therapist. So we had like 3 therapists going on at the same time.
Never mind your son's therapist, right?
Right, yeah. And then he had speech therapy and occupational therapy. And for a while, we actually for several months, we had to put his therapies on hold so we could just focus on us.
Yeah.
That was really hard, because the child becomes the center of the family universe.
Right. And yet you have to find a way to pay attention to your relationship, or it doesn't exist after a while.
Yes.
So it was really smart of you guys to do that, because I think so often that doesn't happen.
Yes.
So how did you have the wisdom to know you needed to do that, even though it was so difficult?
Wisdom is an interesting word for it. I don't think it was wisdom. I think it was desperation.
Desperation, right? It was wisdom couched in desperation.
Right, exactly. We took turns each being clinically depressed, and then we each took turns with some post-traumatic stress. And my husband in particular had an episode of post-traumatic stress disorder, like an actual diagnosis of it, after my son went missing twice.
Well, yeah.
And so after the second time happened on his watch, he kind of just fell apart, for lack of a better word. And that was when we realized, okay, we really need to get serious about our self-care and our care of each other and all of that. So I would say over a period of about 10 years, we had to learn how to really take care of ourselves and put our needs first.
And I think that's incredibly important for you as a therapist to have your own act together and to know what you bring to the table, as well as any of us can, right?
Yes.
And what are you bringing to the table so you can really be there for your clients?
Yeah, and I think that's one of the biggest challenges for me, not only as an autism therapist, but as a trauma therapist, is to realize when these things trigger my stuff.
Right.
Because it's very easy for that to happen. And it's very easy for me to go, no, I'm okay. Just last week, we had an episode with my son where I needed to take a day off. And it was very difficult for me to call up those clients and say, I can't come in, I'm sick today.
Yeah.
But I had to. And thank goodness for my husband, he was the one that said, yeah, you're not going in tomorrow because we've just had a really difficult time and you need to rest. You're not going to be any good to them. And so he was right.
Yeah. So can you talk some more about the hard times? You talked about his being missing and then just this episode the other day.
So the hard parts have vacillated between helping him learn how to communicate better, because he's verbal but not very conversational, and he's 19 now, so we've gone through extensive speech therapy, occupational therapy, art therapy, you name it, we've done it. I think we've done it all, and everything has helped a little bit. So what I think our biggest challenge is at this point is helping him, because he does realize he's different and can't always communicate. We're teaching him how to communicate through typing. And I'm finding the more that I work with clients similar to him, the more I realize, oh, I bet he's got this going on too. So a lot of my clients with autism have post-traumatic stress disorder because it's the nature of being trapped in a body that doesn't work the way you want it to.
Yeah. Plus the feedback from the outside world that,
Yes.
like you say, he now knows that he's different and how hard that is.
Yes. And for a long time, and I know a lot of parents do this, and through no fault of their own, they're taught that their kids are kind of trapped in their own head and in their own world, and that they don't really understand what you're saying. And I've found that to be completely not true.
Yeah.
They understand everything. They're hearing everything, even if they can't let you know that they are. So as a parent, when you realize that, when they come out with something like, hey, I'm not stupid, a lot of them will type and say, I'm really smart and I'm in here.
Yeah, right.
It's heartbreaking when you think back of all the times when, you just assumed that they couldn't. So in dealing with my own journey in that way, I have to pay very close attention to that part. Just being very mindful of my own journey and making sure it doesn't get mixed up in the clients that I'm trying to help.
And sometimes I find those triggers, those times that are a gift because it lets me know what I need to work on.
Yes.
Yes. Like, oh, I thought I'd fix that one, but
Absolutely. And it's so interesting. I have one client, a mom who I've been treating for about 4 years, and whenever she's going through something with her child, I'm always going through a similar thing with mine. So it's a blessing and a curse because I have to tread very carefully that, the session is hers and I'm not going to get the countertransference. But she'll say, have you ever experienced anything like this with your child? And I'll go, yeah, last week.
Right.
And she gets this look on her face like, oh, thank God, I'm not crazy. What do I do? What do I do next? And
Right.
sometimes I say, sometimes we just need to learn how to sit with these yucky feelings. And sometimes that's enough.
Yeah. And I think that it's such a gift for your clients that you have this experience and that you're willing to share it, that it's appropriate to share. It's not sharing so that they can feel sorry for you, but sharing so that they can be reassured about we're on this journey together.
Yes. And it's, I have to be careful when I do the support group, because I do have sometimes brand new mommies who have a 3 or 4-year-old child that's just been diagnosed. They're in a place of extreme grief. And hearing me talk about how, my son stripped down and ran naked in Target, true story, when he was 13, isn't going to be helpful for them.
Right. It's kind of terrifying for them. Yeah.
That would be terrifying, even though I can look back on it and laugh and make jokes about it and see the humor in it. They're not at that point yet.
Right. So how do you do that in a group where you've got people at, obviously it sounds like very different stages in their adjustment and living with autism?
Yeah, that's a great question. What I try to focus on more than anything else is the experience of the women. So it's a mom's group that is focused on them, not the autism. So the autism brings them together and it's what they have in common. But I'm very focused on what are your goals for this group? What are your goals for the session? And most of the time it's things like self-care. They don't call it that, but I'm exhausted. I don't have enough time for myself. I don't know what to do. People are judging me. What do I do about my mother-in-law? A lot of it is focused around that experience. So I will often bring it back to that. And they know that from the get-go. I'll say, this is not a complaint session. You can complain all you want, but we're going to bring it back to, okay, how does this affect you and what are you going to do?
Right. How to handle, I would think, all those people telling you how to raise your child.
Yes, there's lots of them.
Right. I think the other thing in my experience has been, they feel so isolated and it's so hard to go to social events and people are talking about their kids. I know my kid graduated, he was valedictorian, he was this, that, and the other thing. And you think, I got my kid to put his socks on today.
Yeah, exactly.
And that's such a wonderful accomplishment, but that's not what you're going to say
Right.
those other
Right.
folks.
Yes. So there's a lot of that. When I talk about grief, I tell them the story of how you can't really control when the grief comes and goes. Grief just comes upon you, and you have to listen to it and pay attention to it. For me personally, every birthday that my son had up until age 16, I want to say around 16 it stopped. Every birthday I would break down crying. Every birthday was a grieving time for me. And so when I realized that, I had to set aside time to sit and journal and grieve and cry and look at old pictures or whatever I had to do. And eventually it started to go away. But every year on October 10th, I would have to put it on my calendar. And I've just told the mommies that I work with, it just is what it is, and you have to accommodate your life around it. Lean into it and go with it. If that makes sense.
Don't be afraid of it, and don't try to deny that it's there, because it just bubbles up then in other ways that are destructive.
Yes. Yeah. Like, in the middle of the supermarket when, you see a neurotypical child who is your child's age, and then suddenly you're bawling.
Yep.
Oh, yeah.
Exactly. Yeah. So what approaches have you found to be most helpful in treating clients with trauma?
With trauma, I find EMDR is my therapy of choice, and it's my my theoretical basis, that I kind of base all of trauma experiences around. When I found EMDR, it was because of my husband's experience, and he found an EMDR therapist that I had my husband back after that therapy. And it was after a couple sessions, and I thought, what kind of magic is this? Like, I need to figure this out and learn it. So I went for training, and I was all about it. And I'm one of those people that my husband calls me a Kool-Aid drinker. When I am in it, I'm in it. And I'm like, teach me this. I want to know the ins and outs. I'll read every book on the subject. So I just ate it up, and I started using it not only with the moms and dads that I treated, but with the people with autism themselves, and then with the siblings as well. It seemed that everybody had a little bit of trauma in that family that could be treated. So that's my go-to of choice, and using that in conjunction with mindfulness exercises.
Can you talk a little bit more about what EMDR is? Because not everybody
Sure.
in the audience will know what that is.
Yeah, so it stands for eye movement desensitization and reprocessing. And it's a way of taking the traumatic experience and helping the brain digest it. So, and you use eye movements, typically, the same eye movements that you would have during REM sleep. So I'll move my fingers back and forth, or I'll use an iPad app with a ball that goes back and forth, and have them move their eyes in a certain way while they're thinking of a difficult traumatic memory or a difficult time. And then we connect that also to a belief that they have about themselves. And so you're getting to really the root of what that traumatic experience says about you.
So a meltdown in the supermarket, and then the thought is, I'm a terrible parent.
Yes.
Everybody knows that now.
Yeah. Everybody's judging me. Everybody thinks I'm a terrible parent. Sometimes that goes back to, during an EMDR session, you might have them flash back to a time when they were, in middle school and felt that way. Oh, everybody's judging me. Oh, well, okay, because our brain puts like with like in the same folder. That's why that got triggered. And it's just fascinating. And I find that people get better much faster with that method than with just talk therapy. Because you're accessing a part of the brain that we can't access by just talking about it.
Right. So any other techniques that you use, any other strategies that you found to be helpful?
I use a lot of mindfulness techniques, a lot of breathing exercises. I use the Heart Math program.
Which talk a little bit about what that is?
Yeah, that's basically a neurofeedback type of program. It's a computer program that you hook up to your pulse to measure heart rate variability. And they take you through different breathing exercises to help regulate your heart rate variability. And being able to see the difference in your heart rate it's just it's comforting. I actually used it myself one time when I was having a panic attack several years ago. I kind of grabbed the pulsometer and put it on my finger, breathed through, and watched it get better. And seeing it on the screen, I was like, okay, I'm going to be all right. And ever since then, I've used that with clients as well.
So it gives a sense of control then, that people realize they can control that, what feels like an automatic kind of thing in their bodies.
Yeah, because I think one of the most frightening things about panic and trauma, just the whole traumatic experience, is that your body runs away with you.
Yeah.
Your body is holding all of this stuff, and it may not even be on your conscious mind, but the body remembers, and it just reacts.
Yeah. Yeah. What do you wish you had learned in school to prepare you for treating trauma?
I wish I'd learned how to treat trauma. I didn't learn.
Have any courses about that?
Yeah. Oh my goodness! I just read Bessel van der Kolk's book, "The Body Keeps the Score." Yeah. That needs to be required reading for every therapist.
Yep.
Every therapist must read this book.
Bible. Yep.
Oh my gosh! I can't believe I went this long without reading it. I was reading this just like underlining and like a student again, because I don't remember having a course in grad school about trauma. And I think every counselor needs to, whether they want to work with it, I say that in parentheses, with it or not, you need to be trauma informed because it's so prevalent.
It's in the room almost all the time.
Yes.
People come for treatment of addiction or eating disorders or kinds of things. And those are really symptoms usually of something of the trauma. And they're people's solution to the problem rather than necessarily being the problem.
Yes. Personality disorders as well. We're seeing a lot of that. A lot of the research showing such a result of trauma. And then with kids with autism, they have meltdowns and they have inability to self-regulate. And if that's due to trauma and we can treat that, all the behavior therapy in the world isn't going to make that better.
Right. And the behaviors, in my mind, are communication. So what is being communicated by that behavior rather than let's get rid of the behavior?
Yes.
Then where's that communication going to come from?
Absolutely.
Yeah.
Absolutely.
Yeah, cool. So what do you find the most satisfying in working with clients who have had trauma?
I love to see them just get better, and with EMDR, I have seen people get better in a session. I've seen people try to sit with a memory or an emotion and rate it on a scale of 0 to 10 at like a 9.5 and go down to a 3 in 45 minutes. That's incredible. To say to somebody, when you think about that episode, what comes up for you now, which is a question that I'll often ask at the end of a session, for them to say, it just feels like it's something that happened to me and I can move on. I just want to jump up and down and scream and go, oh my gosh, this is so cool.
Francine, thank you. Right?
I know, right? So, that's my favorite part.
Cool. Can you give a couple of examples of folks how they were when they first started working with you and then what progress they've made and what helped make that happen?
Yeah, sure. One young lady comes to mind. She was a 16-year-old, high-functioning autism, and her mom reported that she was talking back a lot and getting very belligerent and wouldn't really engage in conversations with mom. And mom was like, look, I know that I probably messed up somewhere, probably did something I shouldn't have. I don't really know what's going on. So here, fix her.
Right. I know, she'll love that.
I know. So after working with her for a couple months, and I just followed the EMDR protocol, and she had a history of having seizures, really severe seizures. And it turned out that she was really embarrassed that she would have these seizures in the middle of church or in the middle of, a public place. And it was so interesting because she was more concerned about being trouble to the people around her. It was less about what do they think of me, and it was more about, I don't want to put my mom through anymore. She's been through enough. I've put her through enough, which just was amazing because I didn't guide her as to how to feel, but during the eye movements, she would come to these realizations of, gosh, I'm really lucky to have my mom. Or gosh, I'm really lucky to have the community that I have and the church family that I have, that they can call an ambulance and help me and they don't judge me. But it went from, I'm so embarrassed that I could have these seizures in front of them, to, wow, I'm so grateful. And she came up with that realization on her own.
That's awesome.
Which was just amazing. And her mom told me, I don't know what you did to her, but she's a different kid. She's back. My kid is back. We're having fun. She talks to me. It was really, really great.
That's beautiful. Beautiful. Any others you can share with us?
You know, I had another young lady as well, and she's in her mid-20s, and she's fairly independent. She has autism. It's difficult for her to express herself verbally. And so sometimes when she would express herself verbally, I would get bits and pieces of a story, but not the whole thing. Mm-hmm. So I was really nervous about working with her because I wasn't sure how it was going to go. So I had a few sessions with her and mom where mom could kind of translate what she was trying to say. We brought some art therapy into the session. I worked very closely with an art therapist because she was an artist. So she would express herself a lot through art. So we used the art in the EMDR sessions. And then it got to the point where she liked it so much because it has a protocol and it has these steps that you have to go through, that she would tell me what step was next. You know, she would be like, and I'd have all these visuals because I knew she was visual, and she didn't even need them after a while. She'd go, we'd do a set of eye movements, and then she'd go, oh, I'm feeling like it's down to about a 3 now. Let's do 2 more sets. And I'm thinking, how do you know we need 2 more sets? But she was usually right. Like she would do another set, and then she would tell me how she felt. And then we would do another, and she'd go, yep, okay, it's gone. I'm good. It's a 0. All right, so let's install the positive feeling now. And I'd be like, I'm looking at my notes like, is she right? And is that what we She cracked me up. I mean, she just was so smart and so self-aware, but had such a hard time controlling her emotions. That now she'll come into therapy and maybe I'll see her once a month. And she'll come in and say, something happened this week. I want to do some eye movements around it so I can really think about it. And so it might not even be something traumatic, but she'll want to process it with eye movements. And somehow her speech actually comes out faster and easier with the eye movements.
Wow, how amazing. Right?
It's just been amazing. It's, if I had the time, I'd love to do some research, but I just don't have the time.
A good graduate student project, right?
Right, I know.
Yeah. It's also an example of what's trapped inside there. You talk about the intelligence and all of that. And so many people say, well, people with autism don't really have feelings. They don't understand feelings, but
it's the opposite.
Yeah, absolutely. Yeah.
They're like sponges for feelings, and they don't know what to do with the feelings that they feel.
Yeah. Yeah. Cool. So what are your greatest challenges?
Greatest challenges. As a therapist in general, I think my greatest challenge has been coming up with a schedule that's consistent that works for me. My son recently decided he wasn't going to go to school anymore, so I've started homeschooling him. So I had to move all of my clients to evenings and weekends. So I've done that. And, I'm very blessed. I have a husband who's amazing, and he's a teacher. So when the summer comes, then I can kind of step up my game. But just logistics have been the biggest challenge for me. Therapeutically, in sessions, I think the biggest challenge for me has been to be able to separate myself. Like I said before, the countertransference is a big issue that I need to be constantly aware of, because so many of my clients are experiencing the similar things that I was.
Yeah, and it's not like for some of us who are wounded healers, our stuff is in the past.
Yes.
And for you, it's like present every day. So I would think that would be a bigger challenge for you.
It is. It's a bit. Some of the stuff is in the past, like the grieving, I think, is pretty much in the past. But now I'm coming into a new frontier of young adulthood. And what do we do when my husband and I aren't around anymore? Yeah. And all of that stuff is kind of a new frontier for me.
Right, right. Any final words of advice for folks just beginning to treat trauma?
Read The Body Keeps the Score. Read that book. It's incredible. Bessel van der Kolk's work is incredible. Francine Shapiro's work is incredible. She's the one that came up with EMDR. And do your own work. I mean, I think that that's the best piece of advice that I could give. Do your own work and consult with other professionals.
Mm.
You know, we're never too much of an expert in whatever we're doing to consult with other professionals.
Right, right. To have some humility.
Absolutely.
Right.
Oh,
Yeah.
it's such a humbling profession, I think. Yeah.
But humbling and rewarding.
Absolutely.
Yeah.
Absolutely.
Yeah, cool. Well, Janeen, thanks so much for being with us today. I think you have a gift for the audience.
I do. I have a giveaway. It's through my Autism Blueprint website, and so I gave you the link to that.
The link, yeah.
And it's a best practices handout for therapists that want to work with autism families.
Thanks so much. That's wonderful.
My pleasure. Thanks for having me.
Yeah. And thanks everyone for being here. I hope you got as much out of Janeen's interview as I did. Please opt in for her special offer of 5 best practices for therapists working with autism families. I know it'll be invaluable for you in your practice. So thanks again. Bye-bye.